Marty Nemko. Problem of the day, reinventing healthcare. Most people agree the system is broken, costly, often ineffective, and proposals such as uniform national healthcare are inadequate. There are too many reports of long lines and delayed care in countries with single payer, despite major increases in taxpayer-paid budget. Britain's National Health Service is functionally broke. At least equally problematic is the U.S.'s middleman. The insurance companies seem to specialize in denying coverage, but not before making doctors and patients go through inordinate paperwork. Of course, because emotion is involved, after all, this is life and death, we are subject to emotion-centric opinions. For example, with regard to single payer, liberals will support it with, for example, isn't a human a human? Conservatives and libertarians might argue, if people can't use the money they've earned to better protect their health and is relegated to buying a faster car, isn't that cosmically unjust, especially when treating a perennially unemployed gangbanger equally would make societal contributors wait longer, maybe extending pain, endangering health, even life. There is no perfect solution. But here is a three-tier system I dub smart care. Tier 1. By virtue of being human, everyone, whether they pay or not, criminal or not, should be entitled to basic care, with an emphasis on preventive medicine, including AI-assisted self-care and professional diagnostics. Priority would be on cost-effectiveness. Because of the above, Tier 1 would be superior to today's Medi-Cal. Tier 2. Payers into the system and cash payers could buy beyond the basics, for example, shorter waits, especially for time-sensitive issues, pain, life-threatening, choice of doctor, expensive treatments of documented cost-effectiveness. Tier 3. For a higher fee than Tier 2, Tier 3 would offer shorter waits for not urgent matters and coverage of expensive and experimental treatments that have a reasonable probability of cost-effectiveness, but a lower bar than for Tier 2 procedures. Tier 3 payments would fund not only their care, but R&D to improve health care for all. All tiers would eliminate the insurance company middleman. It would be administered by an ideologically diverse blue ribbon committee whose mission would not be profit, but cost-effectively improving gross world flourishing. All would be transparent. Not just pricing, but risk-adjusted success rates for procedures, providers, and hospitals. Why it wouldn't work. Every year, Medicare has many billions of dollars of waste, fraud, and abuse. Even with public-private oversight, expanding government-run healthcare to everyone would greatly increase that. As mentioned, the cost would be enormous, requiring major tax increases, eating seed corn that creates jobs and funds R&D. The already hollowing middle class would likely be hard hit, either accepting Tier 1 healthcare paid for by their tax dollars or paying more for Tier 2 or 3. Whether those increased costs would outweigh cutting the insurance company middleman is an open question. The insurance company has among the most powerful lobbies, and it will argue that cutting it out of healthcare will cost thousands of jobs, and also that insurance company focus is the same as smart care's, cost effectiveness. Activists for treat all lives the same and populist politicians will push back with media support. I can imagine front-page stories with pictures of hard-looking fat cats getting first-line treatment alongside sympathy-invoking poor people getting the minimum, for example, waiting on long lines in a dingy clinic. In sum, clear eyes should focus on what would net most cost-effectively improve gross world flourishing. With that as a metric, it would seem that smart care would beat the status quo or one-size-fits-all government-run healthcare. What do you think? In any event, that's problem of the day, reinventing healthcare. As usual, I welcome your thumbs up and accept your thumbs down. I always look forward to your comments and especially like it if you hit the share button below. Share on your social media so that my efforts can have broader impact. And I am flattered if you choose to subscribe to my channel. And certainly would welcome you taking a look at any of my 36 books. Perhaps most relevant to this is Thought Experiments, but all 36 are on Amazon. In any event, I thank you for watching. I am Marty Nemko.